So to reiterate, ApoB is so important because it is a higher risk for plaque formation. So when I describe it to people, sometimes I'll also describe it as like that high ApoB, like you have more like sticky cholesterol. So the more ApoB we have, the more opportunities we have that we're going to hit those arterial walls, get stuck there. Then the LDL can penetrate the artery walls. We get that inflammation, we get plaque formation. So it's kind of, it starts this, cascading process, but it is a very high risk. Lifestyle is number one thing that we want to be looking at here. So again, saturated fats are a big one. Again, I'm not coming after the carnivore diet. We just need to mitigate risks here. So if you're doing carnivore, really high in saturated fats, we want to be watching and making sure that we're not causing issues. Overall, less fried foods, increase your intake of like olive oil and avocados and nuts and like omega rich fish, things like that is going to help to lower ApoB. Increasing fiber intake, again, those carbs are bad. So limit the refined carbohydrates and sugars. If we're doing carbs, we need to be doing those complex carbohydrates. We really want to stay away from the processed, packaged, over-refined junk food. Of course, we need to exercise and work on losing weight. That's always a huge one. Limiting alcohol intake. And then if there's any kind of secondary issue, like menopause or even low testosterone levels for men can do this as well, or hypothyroidism, we want to be addressing those underlying hormonal issues to work this out. And then adding in supplements. So omega-3s and niacin are both really good for helping with ApoB levels. So your polyphenol-rich foods, green tea, things like that are going to help antioxidant-wise. And as far as a goal, we're really aiming for a ApoB level around or less than 90 for the average person.